I am Dr. Ujjwal Debnath. I'm going to show you the case of a young lady with a cervical disc prolapse which has been painful for some time. We're going to show the surgery for cervical disc replacement on her at C5-6 level. This is the MRI scan showing the cervical disc prolapse at C5-6. Cervical disc prolapse, when it is large, can cause compression on the nerve roots, and removal of the offending disc is usually required in these cases. This lady had been suffering for some time, around 7 months, severely enough, and had all conservative measures failed in her, and she opted for cervical disc replacement. The patient is positioned supine, and after identifying the level on the C-arm, we make an incision. And once we have gone through the skin and platysma, we dissect the muscles and get into the prevertebral fascia. Gentle retraction of the esophagus and trachea on one side and carotid jugular complex on the other side. The exposure was secured by positioning the Cloward retractor, as you can see here. An axial distraction was obtained by a Casper retractor, which the Casper pins we are putting on the proximal as well as the distal vertebra, and identifying the level and the center of the spinous process, which will give you the center of the cervical vertebra. Take the disc out and mark it thoroughly so that there is no room for any injury to any of the structures. We remove the disc in piecemeal with the help of a ronger, especially size 2 or size 3 rongers are available, and you can use them to get the disc out. We have to make sure that we keep the end plates intact, because the disc that we're going to replace with the artificial disc, it has got 3 pins on the top as well as below, which gets into the end plate and helps to be stabilized. So we are using 90-degree nerve root retractor to identify the posterior longitudinal ligament, and then try to remove as much of the posterior longitudinal ligament to see the spinal cord. Sometimes a curette can be used to get to the ends on the sides and remove the facets. Thorough discectomy and complete decompression of the neurological structures are required. The implant is being made ready by the surgical assistant. You can see we are now introducing the implant into the disc space. After identifying on the C-arm, make sure that it goes in properly and does not endanger the spinal cord or any neural structures, and it has to be in the center. Then we remove the impactor, and you can see on the C-arm the disc is properly placed on the AP and lateral view, and this is the view that you can see. And next, after hemostasis, we are closing the skin. Following the application of sutures, we use a drain. Postoperatively, we use the cervical collar for at least 10 days, and we advise the patient to not shower around the wound and keep it dry for the first week, and avoid any journeys which are uncomfortable.
আপনার নামটা?
গোপা সরকার।
আপনার কি হয়েছিল?
আমার অ্যাকচুয়ালি এখান থেকে পেইন হতো, এখান থেকে ননস্টপ পেইন হতে কোনোই অবধি নামতো।
কদিন এরকম ব্যথা হয়েছিল?
ব্যথা হয়েছিল বলতে আমার শুরু হয়েছিল 2019 থেকে, তারপরে তো এই অবধি চললো অনেক জায়গায়।
অপারেশন হয়েছে?
অপারেশন হয়েছে।
অপারেশনের পর এখন কেমন আছেন?
অপারেশনের পরে আমার পেইন নেই, ভালো আছি।
The intent of the artificial disc is to preserve motion at the disc space, and individual's quality of life and ability to function is considerably improved. Thank you very much for seeing the video, and thanks to my team for supporting me in the surgery.